So we spend a lot of time on this show optimizing things.
Right.
We talk about productivity hacks, financial arbitrage, tech shortcuts. But today I want to look at a system that honestly feels entirely broken. And I want to see if we can optimize our way out of it.
You're talking about healthcare.
I am.
Yeah?
Yeah. And specifically the cost of it. Because we are looking at a recent West Health Gallup poll here, just staring us in the face. And the numbers for 2026 are they're grim.
Extremely grim.
Nearly half of U.S. adults say they are genuinely worried they won't be able to afford essential health care. And I want to stress that not nice to have elective care, essential care.
It's a staggering statistic. I mean, it really sets the stage for why we're doing this deep dive today.
Right.
We aren't talking about medical tourism for, a nose job or a spa week in the mountains.
Right.
We are talking about people, regular people, who are looking at their insurance premiums, their massive deductibles, and their bank accounts, and realizing the math just doesn't work anymore.
It really doesn't. And usually the conversation just stops there. We complain, we debate policy, maybe we switch insurance plans during open enrollment and, I don't know, save $20 a month.
Exactly.
But the sources we're diving into today, specifically this comprehensive report regarding global medical havens, along with some really fascinating rankings from International Living, they suggest a much more radical solution.
Radical is the right word, because the solution they present isn't a new insurance plan, it's a new geography.
Yeah, we're talking about leaving the U.S. healthcare system entirely, or at least stepping outside of it for significant medical needs. We've got these rankings here that highlight 5 specific countries where they claim you can get world-class care for literal pennies on the dollar.
And I know that sounds almost too good to be true.
It does. I have to admit, I was incredibly skeptical reading through this.
Skeptical about the cost or the quality?
Mostly the quality. I mean, we're conditioned here to believe that expensive automatically equals good.
No.
If I buy a generic cheap charger for my phone and it breaks, that's annoying. If I get discount heart surgery and it breaks.
That's it. That's the end of the line.
Exactly. So the immediate thought is this actually safe?
That is the core question we need to unpack today. And the mission for this deep dive is for you, the listener, to really explore these 5 countries and debunk the myth that price and quality are perfectly correlated in healthcare. We're going to look at 2 different models of care, the European efficiency model and the Latin American access model.
Okay, let's start with the context, the why. Because packing up and moving to a foreign country, or even just dealing with the logistics of flying there for a surgery, is a massive hassle. You have to be pretty motivated to do that.
Absolutely. The sources call them push factors.
Mm-hmm.
And it's not just one single thing driving people away. Obviously, cost is the headline, but there's also the very real issue of access.
Yeah.
In the U.S., even if you have great insurance, you might wait weeks or even months just to get a consultation with a specialist.
Oh, I know. I tried to book a dermatologist recently, and they basically offered me a slot in the next decade.
I believe it.
I'm exaggerating, but honestly, only slightly.
But that's the reality for millions of Americans right now. So you have this toxic combination of high cost and low accessibility. And it creates a whole class of people that the report refers to as medical refugees.
That term really hits hard. Refugee implies you're being forced out of your own system.
In a way, they are. These aren't just wealthy adventure seekers looking for a change of scenery. We're talking about retirees on fixed incomes who suddenly realize one bad diagnosis will wipe out their entire life savings.
Right.
Or younger freelancers who literally cannot afford the monthly premiums. There's a quote here from Jennifer Stevens, the executive editor at International Living, and she frames it beautifully. She says, "These countries don't just offer cheap health care. They deliver peace of mind."
Peace of mind. That is a commodity we really don't price into the U.S. system. We price the procedure, the meds, the room, but not the anxiety surrounding the whole ordeal.
Exactly. But I do want to make a crucial distinction right early on, because you might be listening to this and feeling a bit confused. Are we talking about packing up your life and moving to these countries forever, or just visiting for a procedure?
Right. Do I need to sell my house and learn a new language just to get a knee replacement?
It completely depends on the country and the specific system, which we'll get into. Some of these medical havens work best if you are a legal resident and expat actually living there.
Okay.
But others are perfectly set up for what we call medical tourism, where you fly in, get treated by top doctors, and fly out.
Yeah.
It's absolutely not a one-size-fits-all approach.
Okay, so how did International Living actually pick these top 5 countries? Is this just based on, like, who has the nicest beaches for recovery?
No, the methodology is actually quite rigorous. They use a mix of hard data, and this is the most important part, real expat feedback. People actually on the ground. They look for systems that meet 4 strict pillars. 1, affordability, obviously. 2, high qualities, which means full modern facilities, highly trained staff, international accreditation. 3, easy access.
Can you actually get an appointment when you need one?
And the 4th?
Language. Are these providers welcoming to English speakers? Because if you're having a medical emergency, the absolute last thing you want to be doing is frantically using Google Translate to explain your symptoms to a doctor.
Oh man, that is my literal nightmare. I think my appendix burst translating to, I would like a warm cheese sandwich.
Exactly. That's a fast track to disaster. So to visualize the cost difference before we jump in, the report makes a great comparison. Seeing a highly qualified doctor in these havens often costs less than a casual lunch out in the States.
A lunch out? That's wild. Okay,
Yeah.
let's look at the list. We have 3 countries in Europe and 2 in the Americas. Let's start with Europe. France, Portugal, Spain. Now, to me, and I think to a lot of people, Europe implies massive bureaucracy.
It implies waiting in line 4 hours at government offices. Is that a fair assessment of their healthcare?
It's a common stereotype, but let's look at the reality on the ground. Let's start with France. The World Health Organization consistently ranks France's healthcare system as one of the best, if not the best, in the entire world.
Okay, but isn't it basically impossible to get into? Don't you have to be a citizen who pays taxes there for decades?
No, and this is the big surprise in the research. If you are a legal resident, meaning you have a visa and you live there, you can access their world-class system after just 3 months.
Wait, 3 months? That's an incredibly short probation period.
It really is. And once you're in, you're part of what they call la sécurité sociale. Now, we need to clarify this term because it trips people up. In the U.S., Social Security is your retirement check. In France, it refers to the Universal Health Fund.
Oh,
It's a massive, heavily government-backed system.
So does that mean it's entirely free once you're in?
It's not free, but the out-of-pocket expenses are extremely low, often almost nothing compared to the U.S. You pay a small portion, the state pays the rest. But here is the real deep dive aspect of the French system. It's not just about the money, it's about the interface.
What do you mean by the interface?
Think about the U.S. Finding a doctor who takes your specific insurance network, is actually accepting new patients, and is within driving distance is basically a part-time research project.
It's exhausting.
In France, they have centralized all of this with tech. The source highlights a specific app called Doctolib.
Doctolib sounds like a library for doctors.
It effectively is. It's a centralized national platform where you can book appointments for almost any medical professional in the country. And here's the massive hack for expats. You can filter it by language.
Seriously?
Yes, you can literally toggle English speaking, and it instantly shows you every qualified provider available near you.
That seems so incredibly logical. Why do we not have that?
Because our system is entirely fragmented across hundreds of private insurers. In France, it's unified. So, for the listener who might be worried about the language barrier, technology is completely bridging that gap. But France is definitely a residency play. You move there, you join the system.
Got it. So France is for the person ready to actually relocate. What about Portugal? Is it a similar setup?
Portugal is similar in structure. They have a robust public system and a parallel private one. But the feedback from expats there focuses on something totally different. It's less about the tech and much more about the human element. The clock, essentially.
The clock.
Time, the absolute scarcity of time in medicine. We have a story in the report from an expat named Kimberly Ann. She noted that in the U.S., she always felt like she was on a medical conveyor belt. You get 15 minutes, the doctor types furiously on a laptop, hands you a prescription, and you're out.
The classic doorknob consultation. By the time the doctor finally has their hand on the doorknob to leave the room, you suddenly remember the actual question you came in to ask.
Exactly. We've all been there. Kimberly noted that in Portugal, the providers actually sat down and listened to her. They took her concerns seriously right from the start. And she didn't have to fight tooth and nail just to get a referral for testing. They scheduled tests quickly.
But how? How do Portuguese doctors magically have more time? Are there just way more of them per capita?
It largely comes down to administrative burden. In the U.S., a huge chunk of a doctor's day is spent documenting for incredibly complex billing codes just to satisfy the insurance companies. In systems like Portugal's, that billing process is drastically simplified.
Less paperwork.
Less paperwork means more face time with the actual patient. So it's not just about being cheap, it's about finally being heard.
So the U.S. efficiency isn't about rushing the patient to health. It's about rushing the paperwork out of the room so they can bill the next guy.
Precisely. And that leads us perfectly into Spain. If France is about the seamless system and Portugal's about the human connection and time, Spain really seems to be about pure value.
I have to say, the numbers for Spain in this report were hard to believe. I saw the mention of private insurance costs, and I thought it was a typo.
You're talking about the figure from CP Tabibian.
Yeah, she's an expat living there, and the report says her private insurance runs about $75 a month.
That's right. Roughly $75 to $100 a month for comprehensive private health insurance.
Okay, I have to play the skeptic here. $75 a month in the U.S. gets you literally nothing. Maybe a catastrophic, bare-bones plan with a $10,000 deductible where you still pay for everything anyway. What does $75 actually get you in Spain?
It gets you full, comprehensive private care, covering nearly everything. And here's the real kicker. This often includes zero copays.
Zero copays. So you just walk into a private clinic, see a top specialist, and walk out without even opening your wallet.
Correct.
Economically, how does that math even work? Are the doctors over there just working for free?
No, not at all. But they aren't carrying the massive, bloated overhead of a typical U.S. practice. Malpractice insurance is significantly cheaper because the culture of litigation isn't the same. Drug prices are aggressively negotiated by the government, which suppresses the cost for the private sector, too.
That makes sense.
And yes, salaries, while very good for the cost of living in Spain, are not at U.S. levels. It's essentially a deflated cost balloon.
So when we pay $500, $600, $700 a month in premiums here, we're not actually paying for better care. We're paying for the litigation risk, the administrative bloat, the pharmaceutical profit margins.
We are paying for the entire ecosystem. In Spain, the ecosystem is just much leaner. And for expats looking at places like Madrid, Barcelona, Malaga, or the Costa del Sol, English is incredibly common in these private clinics. So again, the barrier to entry is way lower than you might assume.
Okay, so that's the European side. High structure, very residency-focused, incredibly affordable. But let's say you are listening to this and you just don't want to cross the Atlantic. The report also highlights the Americas, specifically Panama and Costa Rica. How do these compare to the European model?
The vibe in the Americas, particularly in Panama, is much less institutional. It's a very relational, hands-on culture.
Relational. Okay, we need to talk about the WhatsApp thing. Because when I read that doctors in Panama frequently communicate with their patients via WhatsApp, my immediate reaction was, is that even professional?
It's a massive cultural shift for an American. In the U.S., we are so used to IPAY laws, clunky secure patient portals, two-factor authentication just to see a lab result.
Yeah.
In Panama, it is very common to just get your cardiologist's personal cell phone number.
That is wild.
You literally text them on WhatsApp. Hey, doc, I'm feeling a weird flutter in my chest. And they text back, come into the clinic at 3.
But isn't that risky? What about privacy data? What about professional boundaries?
It's absolutely a trade-off. You are trading a layer of absolute legislated privacy for absolute immediate access. And for the expats interviewed in the report, like Jess Ramesh, they found it incredibly liberating.
Liberating.
Yes, they felt cared for personally, rather than feeling like a liability being processed through a portal.
It honestly sounds like the way medicine used to be here in small towns like 50 years ago. The old country doctor approach, but on a smartphone.
That's a great analogy. And this is really important for the quality assurance piece. These are providers with modern, world-class credentials. Many of the doctors in Panama City actually train abroad in the U.S. or Europe. The report specifically mentions that many are affiliated with prestigious U.S. institutions like the Cleveland Clinic.
Okay, dropping the Cleveland Clinic name definitely helps the credibility. It reassures you that it's not just some guy operating out of a back room.
Exactly. These are board-certified physicians using top-tier technology. But they operate in a culture that genuinely values direct patient access. And for someone who is exhausted by the U.S. bureaucracy, that direct line to your doctor feels like a high-end luxury service, yet it costs a fraction of the price.
And what about Costa Rica? I know a lot of people go there for ecotourism and yoga retreats, but how does their actual medical system stack up?
Costa Rica is super interesting because they use a hybrid model that's proven very popular with American expats. They have a public system called the Caixa. You pay a monthly fee into it based on your income.
Okay.
It's very affordable and it covers pretty much everything. But
Let me guess. The wait times.
wait times.
Yeah.
The system has improved, but for non-emergencies, you are going to wait. So the strategy for most expats is to use that public system as a safety net for the catastrophic stuff. Massive car accidents, major surgeries, and then they just pay out of pocket for the private sector for their day-to-day needs.
And what does paying out of pocket in the private sector actually look like there?
A visit to a private doctor usually runs between $60 and $100.
Wow. Again, we're right back to that specific price point. It's the cost of a nice dinner out.
And that's for a specialist. You don't need to jump through hoops for a referral. You just call the clinic and go. It grants this level of autonomy that I think many patients in the U.S. feel they've completely lost. And medications are significantly cheaper there, too. Costs overall are roughly 1/3 of what you'd pay in the States.
There's a phrase the expat Jess Ramesh used in the report about golden handcuffs. Can we touch on that? Because I think that concept applies to so many people listening to us right now.
It's a huge point.
Yeah.
It's the reality that so many Americans stay in a corporate job they absolutely hate, or they delay their dream retirement for years, purely to maintain their health insurance. Your health coverage becomes a literal handcuff, tying you to your employer.
And realizing these havens exist just breaks the handcuffs.
Completely. If you know that you can get comprehensive, high-quality care in Costa Rica for $100 a month plus some very manageable out-of-pocket costs, suddenly you don't need that specific job anymore. It doesn't just change your medical chart, it changes your entire life trajectory.
I want to pause here and just synthesize all of this. We've looked at France, Portugal, Spain, Panama, and Costa Rica. They all have their own unique flavors and systems, but they all share this core dynamic of low-cost, high-quality care.
Yes.
But I have to ask the hard question, because I'm sure the listener is thinking it. If these places are so incredible, why isn't everyone leaving? There has to be a catch. What happens if you get a highly complex, ultra-rare disease?
That is the crucial nuance we have to maintain. The U.S. remains the undisputed global leader in medical innovation and highly experimental treatments.
Yeah.
If you develop a very rare, specific cancer that requires a phase 1 clinical trial or some brand new $1 million gene therapy, the U.S. is very likely where you need to be.
Okay, so if I'm looking for the absolute cutting edge of the cutting edge, I should stay here.
Right. But for standard medicine, which is frankly what 95% of us need, hip replacements, heart bypasses, standard diabetes management, routine prenatal care, for all of that, the statistical outcomes in these havens are just as good, if not better, than the U.S.
Are they better because surgical techniques are better, or better because of the overall experience?
It's both. But a major factor is that the barrier to entry for care is so much lower. Think about it. If a doctor's visit costs $60, you go the minute you feel sick. You catch the illness early.
Right.
If a visit is going to cost you $300 out of pocket just to chip away at a massive deductible, you wait.
Yeah.
You wait and wait until it becomes a full-blown crisis.
That's a really powerful point. The lower cost itself acts as a preventative medical measure.
Exactly. And I think that brings us to the real so what of this entire deep dive. We have to fundamentally decouple the idea of cost from quality. In almost every other consumer market, those two things are linked. You pay more, you get a better car. In global healthcare, they're simply not linked. Lower cost abroad does not mean outdated technology or bad doctors.
Because in the U.S., the astronomical price tag isn't actually set by the quality of the care provided, it's set by the middlemen.
It's set by the administration of the care. The premium price we pay in the U.S. isn't buying us a premium medical product. It's buying an immense infrastructure of billing departments, coding specialists, legal defense teams, and pharmaceutical marketing that largely doesn't even exist in these other countries.
So when you go to Spain or Panama, you aren't buying discount healthcare. You're buying normal healthcare, just without all the corporate bloat.
You're stripping away the non-medical costs, and you're often getting a provider who has the time and the mandate to actually look you in the eye and listen to you. We're seeing transparent pricing instead of the terrifying surprise billing culture we have here.
Which brings us right back to that idea of peace of mind. It's impossible to put a dollar figure on feeling heard by your doctor.
And it's equally hard to put a dollar figure on the knowledge that a sudden sickness won't completely bankrupt your family. That is what true financial freedom looks like.
So for the listener right now, maybe they aren't ready to pack their bags and move to Portugal tomorrow. What is the immediate takeaway for them?
The takeaway is leverage. Just knowing that you have viable options completely changes how you view your own situation. Maybe you don't ever move.
Yeah.
But maybe if you need a knee replacement and your U.S. deductible is $8,000, you seriously look into medical tourism in Costa Rica.
Yeah.
Or maybe you structure your retirement planning differently because you realize you don't actually need to hoard $400,000 solely for end-of-life medical bills.
It just expands the map.
It really does.
Yeah.
The U.S. healthcare system can feel so much like a walled garden. It's really hard to see over the top. But once you realize there is a whole world of viable, high-quality, English-speaking options outside those walls, the panic of that Gallup poll we started with, it subsides a little bit.
I think that's the perfect place to leave it. We do often feel trapped by our system, but the door is actually unlocked. You just have to be willing to walk through it.
Exactly.
But it leaves us with a really provocative question to mull over. If we can cross a border and get equal or better care, doctors who actually spend time with us, transparent pricing and clearer communication, all for a fraction of the cost, what does that say about the true value of the premiums we pay every month in the U.S.? Is that premium price actually buying a premium product? Or are we just funding the walls of the garden?
That is the question we all need to be asking.
It really is.
Right.
Thanks for walking us through this research. It's a heavy, stressful topic for a lot of people, but knowing there are real solutions out there is, well, it's genuinely hopeful.
It is. Stay healthy, everyone.
And we'll see you on the next deep dive.